I'm a little anxious, but I guess I can say that. I'd like to start just by reading a little bit of the beginning of the book, just so you can get a flavor for what I've done here. Fear ambushes me. It's early on the morning of December 5th, 1989, at least early for a college student, which is what I am. A sophomore at the University of Michigan in Ann Arbor, a bucolic campus of creaky A-frame houses, earnest politics, fraternity sweatshirts, and dollar pitchers of beer. I feel fine. Groggy from a late night of studying, yes. Touched by a bit of that Midwestern late fall dread, anticipating another long winter of fierce winds and sleeping bag-shaped coats. I think this audience can relate to that. But I'm fine. And then, a second later, I'm not. A knot of fear erupts at the base of my spine and travels upward. My stomach flips and I break out in a thin film of sweat. My heart rate shoots up. I feel the erratic thump-thump banging against my ears, my stomach, my eyes. My breathing turns shallow and fast. Fuzzy gray blotches appear before my eyes. The letters before me warp. Words dip and buckle. There's no warning, no prodrome. The onset is as sudden as a car crash. Something in my body or brain has gone dramatically and irrevocably wrong. My noisy internal monologue, usually flitting from school to boys to a laundry list of insecurities, coalesces around one certain refrain. I'm dying. I'm dying. I'm dying. Now, that was a panic attack, but I had no idea what it was at the time. And a panic attack is actually, according to the Diagnostic and Statistical Manual of Mental Disorders, the DSM, just sort of what insurance companies and mental health professionals use to diagnose mental health issues. An anxiety attack is supposed to peak and then abate within about 10 minutes. But that experience in college actually turned into like a month-long panic attack. Yes, there were peaks and valleys to my fear, but it was really persistent, and I ended up marooned on my parents' sofa, just shaking with fear. And it started me on this medical odyssey. I saw about a dozen doctors over the next year, and I had many, many medical tests, EKGs, blood tests, an MRI of my brain, a CAT scan. Doctors speculated that I had everything from multiple sclerosis to a brain tumor to chronic fatigue syndrome. And because the thing is, anxiety can be a full body illness. I think when a lot of us think about anxiety, we think about the cognitive element, the worry. But for me, it was manifesting itself incredibly physically. And finally, it was about a year later that I ended up in the office of a psychiatrist. And I said, you have to help me. I basically said I wasn't going to leave the office until they did something. And the psychiatrist said, well, we can put you on Prozac, the antidepressant, or I can send you to the anxiety disorders clinic at the University of Michigan Hospital. And that was the first time anyone said the word anxiety. Now, there are many definitions of anxiety. I mean, the DSM calls it the anticipation of future threat. Soren Kierkegaard calls it the dizziness of freedom, which I think is kind of an upbeat way of speaking of it. But the definition that most resonates with me is one given to me by a neuroscientist, Christian Grion, at the National Institute of Mental Health, where he said that anxiety is the anticipation of pain. It could be mental pain, it could be physical pain. And, anxiety is a normal human emotion. I mean, a certain amount of it is actually a good thing. Actually, if you have if you have too little of anxiety, it's actually a symptom of being a sociopath, which is not a good thing. A bit of it motivates us to study for tests, to prepare for retirement, to go to the doctor or for feeling off. But at some point, it can become a disorder, and it's the point where it becomes impairing. Basically, when it prevents you from living your life the way you want to live it. And the number of people who suffer from anxiety disorders, they are the most common mental health issue in the US, and the numbers are pretty staggering. about 40 million Americans will have an anxiety disorder each year. And 1 out of 3 Americans will have an anxiety disorder at some point during their life. And 40% of women. So this is not an unusual or eccentric illness at all. And there's real ramifications for it. I mean, someone who develops an anxiety disorder at a young age is less likely to go to college. Those who work make less money. If you have an anxiety disorder, you're less likely to marry and you're more likely to divorce. And also, researchers are finding that anxiety is now being thought of more as a gateway illness, that often other disorders, depression, substance abuse, even suicide, they often start as out-of-control anxiety and often in childhood. It's interesting, this was actually pretty eye-opening to me when I was doing this research, that depression is the mental health disorder that is most closely aligned with suicidal thoughts, but it doesn't often lead to suicidal acts. It's actually disorders like anxiety, substance abuse disorders, some conduct disorders that are more actually likely to lead to suicidal acts. So there are good reasons for us to really address anxiety. Now, in college, I eventually recovered with cognitive behavioral therapy, and I'm sure a lot of people in this room know what that is, but for those who don't, it's a kind of talk therapy where the main component of it, especially for anxiety disorders, is something called exposure. And it is exactly what you think it would be. And it's really not very fun, but it's effective. You basically expose yourself to the very things that you are afraid of in sort of a systematic and kind of supported way. But even since that, now I've tangled with anxiety for 25 years now. And even today, it affects how I work, how I love, and how I parent. There's a bunch of different risk factors for anxiety disorders, and researchers are actually really uncovering sort of the whole kind of panoply of things that make why some people are more at risk than others. And because there's not one single, in my case or in anyone's case, there's not one single sort of smoking gun as to why this happened. Certain types of parenting, controlling, sort of overprotective parenting is thought to help, to lead to an increased risk. Childhood trauma, particularly things like mental illness or substance abuse by a parent, criminal behavior, violence within the family, physical and sexual abuse, neglect, those most strongly predict all psychiatric disorders. But what's interesting is that the trauma specifically linked to anxiety disorders are childhood physical illness and economic adversity. And there's some speculation about, scientists are kind of discovering why this early maltreatment may lead to anxiety disorders and psychiatric disorders more generally, that this can cause actually long-term dysfunction in the body's stress response. And researchers are actually finding that it's correlated with different connections between certain parts of the brain. But of course, the one other thing, talking about the number of people that are sort of affected by anxiety disorders, one thing that was sort of troubling to me as I was launching the research for this book is that the rates of anxiety disorders are increasing, particularly among young people and particularly among college students. And so now about 17% of college students have been diagnosed with or being treated for an anxiety disorder in the last year. And that's up from 10% in 2008. And I've tried to sort of get at why is this happening, and I'm sure probably a lot of people in here may have some thoughts on it, because I know we've got a lot of educators and people, therapists, and people point to everything from from this sort of helicopter parenting that maybe we don't allow our kids to fail as much as we should, or as early as we should, to the growing costs of college. Students are taking out these massive loans, economic insecurity, the rise of social media, and at least one positive possible cause is actually that stigma. It does seem to be eroding, particularly among young people. I mean, I'm actually amazed by when I go to college campuses, when I'm writing stories for the Wall Street Journal about mental health issues, and Students are willing to let me use their name, their faces, their photographs, and details of their mental health issues in my stories. And that was actually one of the reasons why it really prompted me to finally write this book. I'm like, well, if these kids who are at the very beginning of their career are willing to sort of do their part for stigma, to sort of erode stigma, I really I got to get in there too, because I really don't have any excuse not to. But the biggest risk factor for anxiety disorders is being female. And so women have about double the risk as men that men do. And I really also wanted to get at that. I mean, is this just a social construct? Women have been tarred with the label of hysteria. Our emotions have sometimes been deemed crazy as a societal construct, not with any real validity. But there is some evidence that hormonal factors might be at play, and actually fluctuating levels of estrogen could be reason why, at least partly why, women have a higher risk for anxiety. But there's also a whole body of really depressing research showing the differences in how boys and girls are raised. And there's actually a researcher in Canada who's done some fascinating studies. She actually was looking at it because she wanted to figure out why boys get hurt so much more easily than girls. I mean, by the time boys are 2, they have 2 to 4 times the risk of injury as girls do, and they tend to have more serious injuries. And she was trying to figure out, okay, what's going on here? Why are these boys, are getting so injured? And what she found, so she did these series of studies following parents and their preschool children on the playground. And she had them play on the swings, play on the jungle gym, and she also had the parents teach the kids how to slide down a firehouse pole. And it was fascinating because both boys and girls were just as adept at navigating the playground equipment, but when they were teaching the girls how to slide down the pole, parents were much more likely to actually physically touch the girls and assist them down the pole than they were boys. And boys, even when they asked for assistance, they were basically told no, like you do it yourself, to the point where several boys actually tumbled onto the ground. And so, these messages can obviously prevent some girls from getting as hurt as boys, but the other message they send, of course, is that the world is a dangerous place, that girls, you can't sort of navigate it on your own, and so, of course, that kind of feeling of vulnerability can lead to anxiety. Now, this is a really exciting time in anxiety research. Advances in neuroimaging and genetics are starting to unravel some of the mysteries of the anxious brain, and new treatments are on the horizon. And researchers are actually developing programs with the aim of preventing anxiety disorders in kids as young as 3. And we do need new treatments. The 2 most evidence-based treatments are cognitive behavioral therapy and antidepressant medication. But those have actually been around since the 1960s, so there really hasn't been much movement in terms of the actually developing of new treatments. And while these can be very effective for a lot of people, and I personally have benefited from both of these, about half of anxiety disorder patients don't get clinically significant relief after a round of CBT. And 1/3 of anxiety patients are not helped by the current antidepressant medications. So we really do have a ways to go. And scientists are starting to make some interesting strides. They're actually finding that some simple tweaks to CBT can make them more effective. And these are things that we could see in psychologist's office today. And Karen, maybe you'll tell me if we already are. But some researchers have found that actually just having your therapy appointment in the morning can boost its effectiveness, because what happens in the morning is you actually have the spike of the cortisol, the stress hormone, which wouldn't sound like it would be a good thing for anxiety, but actually this sort of acute spike actually can help facilitate learning. And other scientists have found that actually have had patients take a nap after a therapy appointment, and have found that actually enhances the efficacy of it, because it basically consolidates the learning. And researchers at UCLA are actually launching a study looking at what happens when people take a run after a therapy appointment, because exercise actually boosts the level of a protein that is critical for the consolidation of memories. So these are some pretty cool things that are happening now. But researchers are also developing treatments that aim to target the underlying neurobiology of anxiety or its cognitive processes. Now, anxious people have what's known as an attention bias to threat. And what that means is that we simply see more peril in the world. So, me as an anxious person, I'm standing up here, and I'm much more likely to notice those of you in the audience who are frowning or looking really bored or looking like you're going to pass out from the heat than I am those of you who are smiling or engaged. And of course, when I gave this talk not that long ago, I was literally saying those words, and I looked out into the audience, and there was a woman that was dead asleep. So sometimes that attention is biased, there's a reason for it. But researchers have actually developed a simple computer game that aims to reverse this attention bias by teaching people to pay more attention to the neutral things in the environment than the threatening things. So, often it's with a face that's scared, someone making a scared expression versus someone who's making sort of a neutral expression. And so the game, you would just basically continue to direct your attention toward the neutral face. I mean, the research is still pretty in early stages. It doesn't seem to be as effective as CBT or SSRIs, but it is one of those, obviously it's something, I've actually played with it on an app on my phone, so something that there's a very low cost, very low barrier to entry, could be something that could be helpful for people who don't have access to other kinds of treatment, or, that could be disseminated widely, so that's kind of exciting. And then, but the newest kind of sci-fi sounding treatment is something called fMRI neurofeedback. I don't know if anyone's heard of that, but you line an MRI scanner, and you actually see physical representation of your brain activity. And you're told to sort of, given sort of strategies to modify it in real time. And, again, this is early stages, but it does show that people are starting to do some novel things. Scientists are also exploring different medications that might speed up learning and enhance the effects of therapy. There's a drug called D-cycloserine, which is actually normally used for tuberculosis, and but it is found to, in some research, it's been found to actually speed up the learning that happens during cognitive behavioral therapy. But that research is also mixed. But they're also experimenting with substances that are typically thought of as street drugs, things like ketamine, there's a lot of excitement around ketamine for depression. It's a very fast-acting antidepressant, and there's research looking at certain derivatives of ketamine, like a metabolite actually, that doesn't have some of the downsides of what's known as special K, but does seem to have some beneficial effects on particularly PTSD and obsessive compulsive disorder. And even MDMA, people are using that in some trials with people with post-traumatic stress disorder. Now, I'm certainly not advising anyone to go out and score any of these to try to treat their own anxiety. These are all being done only in research settings. And also, meanwhile, a growing body of evidence is finding that meditation, mindfulness techniques, yoga, that there's real serious science behind these practices that they can alleviate anxiety symptoms. And that makes sense to me, because mindfulness, it's all about being in the present moment. And if you think about it, anxiety, it's sort of the antithesis to anxiety. Anxiety is this future-oriented state, this what if. And if you're in the here and now, that's sort of the kind of the antidote to that. So that's exciting as well, to have that sort of codified, something that a lot of us maybe feel kind of implicitly, but actually there's research behind it. Now, I was talking to my primary care doctor recently, and she asked if I was sure that I had chosen the right profession. She was generally mystified. Being a reporter, I'm on deadline a lot. My job also requires me to cold call often hostile strangers who may not want to talk to me. It's anxiety producing. But in many ways, actually, anxiety has fueled my work. It makes me sort of double and triple check that spelling, to do one more interview, to make sure I've got it right. And, actually paranoia and a colossal fear of screwing up can actually be a good quality to have in the workplace. And, of course, when my anxiety soars, it can definitely interfere with my work. And there's one story that comes to mind. After September 11th, I was actually asked to join a group of reporters to report on the aftermath of those terrorist attacks. And one of my first assignments was to write about the anthrax attacks in New Jersey. I don't know if people remember that, but I can't think of a story more tailor-made to unhinge an anxious person. I mean, here you have this unknown assailant sending powder through the mail that could be lethal when inhaled. I can't blame my editors because I didn't tell them about my anxiety issues, so they had no idea when they were sending me in to do this story. So I'm writing about anthrax, and I'm having very late nights. I'm driving all over suburban New Jersey because there was this one post office where a lot of these letters had come through. And late one night, I start feeling breathless. My heart starts racing. I mean, it's clearly a panic attack is coming on. And, I try to tell myself, okay, it's just another panic attack, same as the hundreds you've had before. But, with panic attacks, the weird thing is, at least for me, is I found there's always a seed of doubt, okay, maybe this time I really am having a medical emergency. I'm having a stroke, I'm having an asthma attack, whatever, because it feels so dire. And right at that moment, I see an H sign for a hospital, and I turn off, and I go right to the emergency room. And I leave my car in the parking lot, and I run in, and I go to the triage nurse. And I mean to say to her, I've been writing about anthrax. And I blurt out, I have anthrax. And she, of course, looks totally alarmed. Because, not only is anthrax deadly, it's highly contagious, and it's been all over the news. And so she says, you have to leave, to get out of here now. So she throws me out into the driveway. And, I get there and says, wait there, someone will be there. So I'm standing there, in the sort of shadow of the red ER sign, and I start to feel completely ridiculous. Now sort of the CBT kind of cognitive reappraisal is kicking in, and I start, what is the evidence that I really think I have anthrax? And I say, okay, I have not touched an anthrax-laced letter. I haven't touched anyone who's touched an anthrax-laced letter. There is no way I could have anthrax. I am just having a panic attack about the very idea of having anthrax. So I'm starting to calm myself down, and at that moment, an ambulance comes in, and a guy in a full-on orange hazmat suit jumps out of the ambulance. And I have to explain to this man that I don't have anthrax, I'm writing about anthrax. And I swear I saw him roll his eyes beneath his protective goggles. He gets back in the ambulance and rides away. So, I've dealt with serious anxiety for a long time now, and at this point I don't expect to be cured. For me, it's a chronic illness, and that can sound pretty depressing, but actually, it's not so bad. I know how to deal with it after all these years, a lot of trial and error. I have easy years and tough years. In the tough years, I gravitate to what works, what I've figured out works for me, which is cognitive behavioral therapy, a low dose of an antidepressant. But even in easy years, I have to be careful. I need to sleep 8 hours, eat right, exercise, do yoga, reduce stress, basically all those dull, boring adult things that we're all supposed to do. Those things are really critical for people with anxiety and other mental health issues. And actually, there's a really robust body of research that shows that all of those practices can help ease anxiety symptoms. And also, grappling with serious anxiety actually does have some upsides. Maybe hard to believe, but I mean, when my anxiety is at its worst, it is deeply painful. It really erases life and love. But when it's its more usual low hum, it's actually a really good BS detector. When my marriage is kind of off kilter or I'm sort of saying yes to too many superfluous obligations, I feel it in my hopped up amygdala. So weirdly, anxiety has made me live a more authentic life. And it's also made me more empathetic. I've had to be vulnerable. I've had to ask for help. I find one of the ways I kind of deal with a panic attack is by holding on to a supportive friend and making them walk me around the block over and over again. And that has actually, brought me closer to my friends and family by making myself be vulnerable, and also given me a point of connection to other people in pain. And this, background hum of uneasiness, this constant bracing for catastrophe, it actually has caused me to take more risks, weirdly, and work harder and speak more honestly than I might have otherwise. I'm just simply not mellow enough to take life for granted, and that's actually made my life all the richer. Thanks so much.
Andrea, I'm going to take first dibs at asking you a question.
Here we go.
Yeah, all right, we're on.
Thanks.
Yes. So I'd love to know, what do you wish you knew when you had your first panic attack?
Well, I wish I knew what it was. I mean, that would have been, I think, saved me a lot of heartache, is, that I would have been diagnosed quicker, because unfortunately what often happens particularly with panic disorder, but a lot of anxiety disorders, is that if they're not caught early, what can happen is, especially with panic disorder, is, so say I had a panic attack in line at the grocery store. Well, the next time I may not be willing to stand in line at the grocery store. And so what can actually happen is you start to develop all these avoidance behaviors. And it makes your world literally smaller. And we've all heard about people who end up homebound because they develop so many avoidance behaviors. So I think that would have been the biggest thing, is if I could have been diagnosed quicker, I think my illness wouldn't have been so entrenched by the time I was.
Yeah, one of the problems that we see for most people who have a panic attack is that it's experienced as a catastrophic event. And when we do traumatic or measures of trauma, we find that it functions as a trauma. And so if you get incorrect information, then it increases the uncertainty, the doubt, and you don't really have an answer. And I still have patients who go to emergency rooms and they're told, well, this is all in your head, you're not sick. And the person's walking away having the experience of something is terribly wrong, I know it with all my being, but they don't have an answer. So I'm so happy your book is here and there's all the media, because more people are likely to find the right information.
Right. Well, and now, obviously when I was diagnosed, there wasn't the web, and there weren't the resources that there are now. I think a lot of people could probably self-diagnose pretty easily. But I have to say, I will say that even after all these years of dealing with panic attacks, and I think, having my illness relatively under control, there have been periods of time in my life where I've been sort of a stalker outside of emergency rooms. Like, I wouldn't actually, there was a while that the ER, I would basically pace back and forth in front of the ER at NYU Medical Center in New York, and I wouldn't often go in, but just being there sort of made me feel a little bit better.
Yeah, we call that a safety signal.
You're right.
And that's where someone has something, like they carry their bottle of Xanax, or they have a picture of their pet or their children. Or I've had patients where they felt like, if I'm within a certain range of a trauma center, then I can comfortably travel and be free, but I can't get outside that range.
Right. Well, one thing, I've had a lot of serious panic attacks on tops of mountains. I love to hike, yet hiking also makes me incredibly anxious, and this idea of something, of me falling, bumping my head, being chased by a homicidal bear, whatever I can conjure up. and being so far away from help. That's been,
Well, there's also
difficult.
probably a physiological explanation, because we know when people breathe more rapidly or they're breathing thinner air, they over-exhale carbon dioxide, and that changes the gases in your bloodstream, and it can induce all the physical symptoms of panic attacks. So it's very common for people to have panic attacks. For example, we're all here basically at sea level. To go to altitude and to have their first panic attack, to be smoking and having a hard time breathing and having a panic attack, or to have a cold or the flu.
Right.
And it's associated with changes in respiration.
Right. Well, that's another interesting thing, because one of actually the components of my cognitive behavioral therapy, when I first went into it, one of my biggest fears was about having something being wrong with my heart, because one of my main components of my panic attacks was a racing heart. And so my therapist actually had me run up a flight of stairs.
Good for them.
And then run up 2 flights of stairs. And this interoceptive exposure, this actually exposing yourself to these feared bodily sensations, you basically amass evidence over time that the terrible thing that you think is going to happen, for me it was dropping dead of some catastrophic heart problem, didn't happen. So,
That sounds like you got excellent help.
I did eventually, which was great. Well, Karen, I wanted to ask something about you, because this has come up actually in other talks I've done, and I'm wondering that probably someone else out here may have that question, is that there's been some interesting research about diet and about and sort of gut health and its impact on anxiety, and it's something that I was kind of a little bit new before my book came out, but I'd love to hear maybe what the latest is on that.
Yeah, this is a really exciting area in mental health. What we've been finding is that it looks like inflammation is behind mental illness, just like it's behind other diseases and other illnesses. And what we see is that if you're in third world countries where people are eating a diet that has no refined carbohydrates, then we have lower incidences of depression, suicide attempts, anxiety. And then when people change diet, we see that we get an increase in those disorders related to anxiety and depression. In fact, today I just saw a paper that was released where they were able to do brain scans and detect inflammation, and they found the higher the inflammation in the brain, the higher the risk that the person attempted or completed a suicide. And so what we see is one thing that happens when people are having difficulty with mental health is usually they're having difficulty with their diet. They're feeling stressed, they start to eat junk food or easy to eat food or drinking a lot of things. And in fact, if you were to do a smoothie and to blend it up, you're going to process that fruit and fructose more rapidly, and it'll act like getting sugar.
Right.
So smoothies are very popular, and so one of the things I recommend to all of my patients is you need to eat a Mediterranean-style diet. We know also that pesticides and additives increase inflammation, and if to the extent you can afford it, to eat organically, and we see that that helps improve health. So there are some psychiatric units now that are getting patients to eat lots of veggies and fruits as opposed to what we think of as a standard awful hospital diet. The other thing that's fascinating is we're seeing that the richer the flora and fauna in your gut, it's called the biome, the more you have, the less likely you are to develop mental illness.
So what about probiotics then? Is that
with
something
probiotics, well, the research is uncertain. There are many people who are showing that can be helpful. And then there's studies where people are saying we're not getting enough flora and fauna if we just eat vegetables that have skins that have dirt on it and live in a dirty environment and avoid hand sanitizer and too much cleaning, that's enough. Personally, I take probiotics and I have my children take them. They have anxiety disorders. I'm stacking the deck in my favor, and we recommend this to our patients. And I know of quite a few researchers who are saying this is a good thing to do. The other thing is vitamin D3, and this is the thing that you get in fish oil. And we found that if you have low levels of vitamin D3, you are at a much higher risk for an anxiety disorder or for depression. And so many of the psychiatrists I work with recommend 5,000 international units a day of vitamin D3. And the problem for many people is you have to make sure you're actually getting D3. And so you want to check on the label or the website to see that an independent laboratory has verified that whatever supplement you're taking has that. And so we see vitamin D3, the low inflammatory diet, getting lots of gunk is very helpful. And in fact, I can give a good example. I have a friend who's a pathologist who travels with his young children, and he makes sure they eat on the floor of the airport at O'Hare because he says, I hope I'm getting bacteria from everywhere, and I'm going to lower my kids' risk for cancer and mental health problems, and I want them to have their dirt. So I'm inviting all of you to eat off the floor
At O'Hare,
for the sake of your mental wellness. Yeah. Andrea.
I don't know if that would do really well with my OCD about contamination, but
Yeah.
you know.
Well, it's also treatment for
Right,
OCD.
exactly. It's exposure too. So.
Yeah, so you mentioned stigma earlier, and I'm
yeah.
curious, what are ways that you feel like you've had to battle stigma? And do you feel like the fear of stigma interfered with your ability to seek help or to actually find help?
Well, it's interesting because it's actually why, I started thinking about writing this book probably 10 years ago. And what kept me from pursuing it was really this fear about what it would mean for my professional life. There's statistics from the Anxiety and Depression Association of America where only 1 in 4 people with anxiety disorders is actually told their employer. And the reasons that these people cited were that they were afraid that would limit their opportunities for advancement, that would be put in their employee file, and that would be perceived as a lack of willingness to do the job. And so, for me, I wasn't actually worried about sort of being fired or being, but more, I just didn't want it to be an issue at all. And I was actually, because I knew I worked with caring people, I'd seen them rally around others who were dealing with cancer or other health issues, but I was just afraid that even out of kindness or sort of care, that people would think, oh, can she handle this tough story, or can she handle this workload? And I just didn't want it to be sort of an issue. But one thing that I did do at the workplace was I always clued in at least a couple close friends, work friends, about my anxiety. And that was really critical for me functioning well in the workplace. Because I found not only was there someone that I could, if I was having a panic attack at the office, or my anxiety was just really kind of kicked up, I could text a friend or email a friend and be like, for me, I found one of the things I found that's been really helpful is if I take a walk with a supportive friend and just walk around the block and over again, but not only that, but also being able to be authentic with at least 1 or 2 people at the office, because what can be really exhausting is not only just dealing with a mental health issue in the workplace, but also dealing with this feeling like you have to hide it, and that you can't be yourself, and that you have to sort of put on this facade. So that has been sort of really, really critical. So, and like I said, the one thing that was really inspiring to me was as I was going around and doing these stories about adolescent mental health and seeing that there has really been a shift, I think, particularly in the younger population, and there's this real kind of culture of mental health advocacy, and there's these groups like Active Minds and the Jed Foundation, and you have all these young celebrities who now are speaking more openly about their mental health issues. So I do feel like the conversation is changing a bit. I still think we've got a way to go in our workplaces. I think that's still kind of another frontier. But so that was more about in terms of being able to do the book. I guess stigma in terms of, I guess when I was initially diagnosed, or even before I was diagnosed, I just didn't have a vocabulary for mental health issues. I didn't know anyone who was taking, who was seeing a therapist or taking a psychotropic medication. There just wasn't a conversation about it as much as there is now. Though I know that there's still communities that are also, where stigma is much more,
Right.
is still more entrenched. So, there's still work to be done there.
Yes, and one thing I think that you're bringing up that's really important is anything that you keep secret is going to create shame. And we know shame is like a corrosive to your mental health and to your sense of self. And we see that when people are able to tell other people and seek social support, even if they seek no treatment, they do better and they have a better outcome. And so one thing I do encourage all of my patients to do is don't keep it a secret. Because invariably, most people's response is a sympathetic one because this is so common.
Right.
This, essentially what it means is almost all of us either have it or know someone who has it or love someone who has it. So this is a universal experience compared to some other problems.
Right. And I do feel like there is a couple things, that there still is that thought out there, or that perception among some, at least among some people, that anxiety, specifically, but mental health issues in general, are a weakness or a moral failing. And that's something I'm trying to sort of help combat with this book, that that's not the case. But I even felt like, even personally, I internalized a little bit of that, in that, I grew up in a loving home. I went to good schools. I always had enough to eat, and treatment, the ability to pay for treatment, and then of course when we see some of the terrible things happening in the world, I think it can be easy to say to yourself, well, what do I have to be anxious about? Like do I have the right to be anxious? And that's something that I've sort of grappled with and had to sort of, really internalize, that this is a mental health issue. This is an illness like any other illness, and not only is it legitimate, but it's also treatable.
One thing that I commonly hear, especially from women, is the idea that I thought I was a competent person. Why am I getting so upset? I'm the best person in a crisis, yet I get like this weird feeling in my chest and I just crumble. And one of the reasons that happens is because of uncertainty. And when there's a real crisis, for most of us, we know exactly what's wrong. We have an idea of what we should do, or at least call 911, where if you don't know anything about panic or anxiety or worry, you're caught off guard and you don't have the manual. And then it makes you doubt yourself, unfortunately. So I have another question. What do you feel like has done the most to help you maintain your hope? Because you mentioned that this is something that can't be cured, but it can be well managed. And so what gives you hope, Andrea?
I mean, I wouldn't speak for everybody. I'm sure there's probably some people who, maybe will have a bout and then they're, never have another relapse. But for me, I've had enough of these. I know that, this is just sort of the card I'm been dealt. And I do say, if it wasn't this, it'd be something else. So mine happens to be anxiety. I mean, I guess I just, over the years, realizing that I can manage it and that I can live a really full and rich and, interesting life and still have this thing that I've got to deal with. And also just knowing that treatment's out there, it can work. And also, I mean, it's not always the same thing. I mean, I also found that the flexibility is really helpful too. Like, maybe at this time in my life, this medication worked for me, but at this time in my life, yoga has actually been, or then there's sometimes, when things have been really bad, I've thrown everything at it. It's like, I'm going to do yoga, I'm going to do CBT, I'm going to do this medication, and because I feel like that's what I need to do. So I think flexibility and also just knowledge that there's that there's
you're kind
treatment out there.
of being the example of my ideal patient.
Thank
because
you.
one of the
Gold star
things that
for
I
me.
encourage people to do is to take hope in that there are so many options. And what's exciting for me as a clinician is the treatments that I do now are very different from when I graduated in 1990. And we've tried attention control retraining, such you mentioned about Nader Amir's research. We're using compassion-focused therapy to address perfectionism, because one of the things that we see now is a general risk factor for anxiety is perfectionism. And we also know that is the highest risk factor for suicide. for attempts and completions. And when we look at a culture of overprotection and over-control, we find what it accidentally does is it cultivates perfectionism combined with a feeling of incompetence. And that's a deadly formula. And so what I try to tell patients is your journey is unknown, but it can be good, because I want you to be scrappy and realize we may need to use medication, we may need to try many different approaches, but we know we can make it better, and we know you can live a good life. And I love to see people who say, I'd rather live making mistakes and taking risks than have regrets because anxiety held me back.
Mm-hmm. Right.
Yeah.
Yeah, and one thing I do also, I think about, I have a young daughter who's 8, and one of the risk factors for anxiety is also genetics. Genetics account for about 30 to 40% of the individual risk factor for anxiety disorders. And if you have a first-degree relative, a sibling, a parent, a child that has an anxiety disorder, your risk is 5 times greater than that of the general population. So I do, the one thing that kind of keeps me up at night a little bit is, okay, what sort of genetic albatross have I bequeathed to my daughter? I try not to sort of see every little personality quirk of hers through this like DSM-colored glasses as some sort of nascent psychiatric disorder. I'm not always successful about that. But I mean, the one thing that's actually been really cool, we were talking about this earlier a little bit, is that there's this exciting new research looking at prevention of anxiety disorders, and even in little kids, like 3-year-olds. I actually sat in on a program at the University of Maryland called the Turtle Project, and it's with these, because what researchers can do now is they can actually identify kids really early. There's this temperament behavior inhibition that is very socially shy, reticent behavior that's apparent in toddlers, and it's quite a strong risk factor for later development of anxiety disorders. And so this program actually, it teaches social skills to kids, because often shy, socially reticent kids, they skip the birthday party, they don't do the ballet lessons, and so they don't get the opportunity to actually learn how to have a conversation with another kid or ask another kid to play. So it's a combination of sort of social skills training, but also CBT, basically the kind of fear hierarchy and bravery practice. So basically encouraging, and not just the kids, but the parents, because often what happens with anxious children is that, of course, as parents, our inclination is to protect our kids, and we don't want them to feel upset, but
Right.
we need to encourage them to continue to sort of get out there and approach the things that they're scared of.
Right, and one of the things, there's other research where they took the children of mothers who had anxiety disorders, and they randomly assigned the parents to 2 groups. And one group did good parenting skills, all the stuff we learned, how to talk to your kids, how to do timeout, how to affirm them. The other group, they just taught them how to do exposure. So if your kid was scared of the vacuum, they made them play with the vacuum. If they didn't like clowns, you went to the circus. If you didn't like peanut butter, you had to eat it. And what they found is that 7-year follow-up, the children that were in the group that had exposure parenting had 3.5 times fewer anxiety disorders than the kids who were just given good parenting. So what we see is if you have that in your family, your self-anxiety, your kids need more than good parenting. They have to have practice doing scary and difficult things. And
this isn't always fun, I can tell you that, because I have actually tried to do this with my own daughter, who has a phobia of a lot of kids' movies. I mean, some kids' movies are really creepy. I mean, they're like these, and I had a phobia of clowns. Clowns are creepy, we all know that. but I don't know if anyone remembers the Sesame Street segment from the 1970s where there's this really dejected-looking clown, and he puts on his makeup, and then does anyone remember this? And they actually run the tape backwards, and it looks like, I thought he was taking off his face. It scared the crap out of me. And to the point where I was literally had one foot out the door and would run screaming as soon as I saw that. Anyway, and specific phobia, so a phobia like that is actually a marker, it's a risk factor for later development of anxiety disorders. And my daughter has this serious anxiety about a lot of kids' movies. Basically anytime a character is sort of in peril, which is basically, Finding Nemo, like what? The mother is eaten in like the first 5 minutes. So actually after doing this research, I decided I was going to take her to go see Paddington. And I don't know if anyone's seen that movie, but Paddington has a pretty rough ride. Uma Thurman plays this homicidal taxidermist who's trying to take Paddington and stuff him, and it's this long, drawn-out thing where he's almost shot, and it's terrifying. Anyway, but we'd only seen the trailer, and I already showed my daughter the trailer, and she's like, I am not going to that movie. And I said, no, this is exposure. We're gonna go. So I took her to the movie. Within 5 minutes, she's in my lap. Within 10 minutes, she's sobbing hysterically. But I said, I'm like, okay, I can't, this is too much for me. Like, we can go. She's like, no, I want to see what happens. Snot, tears, whatever. I felt like such a terrible parent. Other parents are looking at me, and but she made it through the whole thing. And the lights went up, and this other mom shot me this look like I was a horrible person. I thought she was, and that I did this to my kid. But after that, Fiona kept talking about the comeuppance that actually Nicole Kidman as a taxidermist gets. Like, finally, this monkey that she was also trying to stuff, like, dumps a bunch of manure on her head, and so like this was the the real kind of she got her payback. And just even a few months ago, we actually watched Ghostbusters, the original, which is super scary. And so I don't know. I kind of feel like I'm winging it, but I do feel like we've kind of turned a corner with these scary movies.